the first presenter is Dr. Kanchan Sharma. Dr. Kanchan, please. She is going to present. Please provide some pen here. Management team.
So should I start?
Yes, please.
So good morning, everyone. I'll be discussing about the incidence of progression in patients with normal tension glaucoma. So normal tension glaucoma is a type of progressive glaucomatic optic neuropathy, and its main difference to primary open angle glaucoma is that it presents with normal intraocular pressure that is less than 21 millimeters of mercury. Although intraocular pressure is measured within a normal range, the optic disc excavation, the visual field defects are detected. It has been suggested that vascular dysregulation is a primary step in initiating glaucomatous damage in normal tension glaucoma via ocular blood flow instability, affecting the optic nerve and retina by the enhancement of ischemic damage, as well as by promoting the apoptosis of retinal ganglion cells and their axons. Various studies have indicated systemic hypotension as a common risk factor in these patients. Low systemic blood pressure, particularly during night, it reduces the ocular blood flow via reduction in ocular perfusion pressure and contributes as a major risk factor for normal tension glaucoma progression. Additionally, retinal venous pressure is increased in patients with glaucoma, resulting in a lower ocular perfusion pressure. Migraines have been frequently observed in patients with normal tension glaucoma, and various genes like WD repeat containing protein 36, myocillin, and optineurin are also considered causative for normal tension glaucoma. So the purpose of the study was to find the incidence of progression in patients with normal tension glaucoma in a tertiary care hospital. Inclusion criteria: all the patients with normal tension glaucoma who have completed follow-up for 5 years, patients with unilateral or bilateral normal tension glaucoma. Exclusion criteria were patients who had earlier received glaucoma surgeries like iridectomy, iridoplasty, and trabeculoplasty, patients with angle closure glaucoma, patients having pre-existing corneal or retinal pathologies, patients having neuro-ophthalmological diseases, and patients who were already on anti-glaucoma medications. So coming to methodology, the study area was Eye Care Eye Hospital and Postgraduate Institute, Noida, and study population were all the patients with normal tension glaucoma. Study design was hospital-based retrospective study, and the sample size were 45 eyes. So 45 eyes having normal tension glaucoma was studied, and data on intraocular pressure, central cornea thickness, Humphrey's visual field, and OCT RNFL before and after the diagnosis of normal tension glaucoma were noted in patients before starting anti-glaucoma medications and followed up for 5 years after starting 1 to 2 anti-glaucoma medications. So the results: the mean intraocular pressure was between 15.71 millimeters of mercury before starting the medications and 12.86 to 13.44 millimeters of mercury after starting 1 to 2 anti-glaucoma medications. 7 eyes had normal visual field on HVF at presentation, out of which 5 eyes showed progression, and 7 eyes having normal OCT RNFL at presentation showed progression after 1 year. 6 eyes had mean central corneal thickness of 480 microns, and rest all had values between 520 to 570 microns. Overall, out of 45 eyes, 16 showed progression and 29 eyes remained stable up to 5 years. Out of 16 eyes that showed progression, 4 had history of migraine and 10 patients were on antihypertensive medications at night. So, conclusion: normal tension glaucoma is within the spectrum of open angle glaucoma, having intraocular pressure consistently below 21 millimeters of mercury. Controlling intraocular pressure as low as possible is the key to manage the normal tension glaucoma patients, along with control of systemic factors like migraine and vascular causes like hypertension. Antihypertensive treatment at night causes decreased optic nerve perfusion, which leads to progression of glaucoma. Normal tension glaucoma is often underdiagnosed, but according to this study, it has 35.55% chances of progression even after starting the anti-glaucoma medications. Therefore, normal tension glaucoma patients should be evaluated for relevant systemic factors and regularly followed up to rule out the progression and stop further damage to the optic nerve. Thank you.
Thank you, Usha. So, most of your patients were on 1 or 2 medications. You said
Yes,
none of the
ma'am.
patients required more than 2 medications.
No, ma'am. Because intraocular pressure was maintained till 13 millimeters of mercury, ma'am. Maximum till 2, I kept the patients.
Okay.
Yes,
So
ma'am.
none of
For
the patient
study.
had more than 13?
No, no, ma'am, none.
Okay. So may I request the next speaker to be there on
On
the
that side.
dais till that time? So,
Dr. Ankita, please,
Ankit.
on that side you can go.
hmm.
So how you explain the higher percentage of progression in your case? You said it will be 35%.
35.55%, yes, sir.
So 35.5% when the patient is on treatment for 2 drugs and even the
Yes,
IOP
sir.
you said target was 13.
So in normal tension glaucoma, in many studies, it has been shown that the vascular factors are also contributing to the progression of the disease. So despite maintaining the intraocular pressure around 12 to 13 millimeters of mercury, patients, especially patients on antihypertensive treatments, and many of the patients are having migraine also, those patients were progressing. So it basically...
Did you do diurnal? Because 13 is the daytime
Daytime.
pressure.
Uh,
Diurnal variation,
Diurnal
did you
variation at the beginning of the diagnosis, ma'am, diurnal variation was done, but since I've done a
24 hours?
retrospective,
do? 24
It's
hours
office hour or
diurnal?
24 hours?
ma'am, day hours during
So
the
you are not
time.
sure about the morning pressures or night pressures?
Yes, ma'am.
And,
Yes, ma'am.
and did you do some 24-hour ambulatory BP monitoring? You said if there are vascular factors, because it's pretty
Ye-
high,
yes,
pretty high
sir.
incidence of progression,
Yes, sir.
which would lead you to a very high risk ratio, you know?
Yes, sir.
Okay,
Okay.
thank you.